Hello, welcome back to Shelby's Book Club. Shelby's here, and go ahead and pull out your health assessment books and read along. Okay. Actually, the point of this is so you guys can just look at the pictures and I do the heavy duty work of reading it. Okay, so we're doing 4, 5, and 7 in this chapter, and I don't have slides to go with it, so here is a cute picture of a kangaroo with its baby. So cute. Okay, so general inspection is the time you meet the patient, you observe physical appearance, hygiene, structure, body movement, emotional status, and deposition, and behavior. Physical appearance and hygiene are big. You want to see the general appearance, age, skin, and hygiene. Are there tremors, facial drooping? Is he presenting about his age? Is there altered growth or sexual development patterns that are irregular due to endocrine disorders? Is there presence of lesions, well groomed? Are odors detected? Body structure and position. You want to see nutritional status, obese, nourish, cachette. Is body symmetry. Look at the position and posture. If they're in a tripod position, they're which is slightly forward with bracing the arms on your knees. They're probably having difficulty breathing. A fetal position is when they're laying down in assumed position on their back, and this is indicating of pain. So check body movement. Are the movements symmetrical, smooth flowing? Emotional status are they alert? Look at the facial expressions, tone of voice. Do they maintain eye contact? Measurements and vital signs are the baseline of what the health status is of the patient. These include 6, temperature, heart rate, respiration rate, blood pressure, oxygen saturation, and height and weight. But the big one is also pain. So yeah, that would technically be 7. Body temperature should be about 98.6 or 37 Cs. This is regulated through, this is regulated by the hypothalamus. Increased metabolism or exercise can cause an increase. So normal variations are only 1 to 1.5 in the temp. It can be through oral, mouth, tympanic, forehead, tympanic ear, temporal, forehead, axillary, armpit, or rectal booty. Oral temperature, you are going to measure the temperature in the mouth under the tongue with, of course, a disposable sheath on it. And this is going to measure the blood supply through the carotid artery. Okay. Temporal temperature, we're going to measure the temperature of the temporal artery by placing the probe on the surface of the forehead and scanning. Obviously put a sheath on this as well. Tympanic membrane temperature, we're looking at the blood flowing near the tympanic membrane inside the ear. So yeah, just scan that one as well. Rectal measures the body's core body temperature. It's more accurate and is performed less frequently because it's invasive and there's risk of infection and it's uncomfortable. When you're taking this temperature, have them in the Sims position with the upper leg flexed. Of course, have a disposable sheath. Apply some lubricant and insert the probe about 1 to 1.5 inches. Okay. and this typically has 1 degree higher. Heart rate, you take by palpating the pulse. Pulse rate is the number of pulsations. Rhythm refers to regularity of the pulse. So put the fingers over the artery and pulsate the rhythm with firm pressure and then slowly release until you feel it. The number of pulsations palpated for 30 seconds or more, or take for 30 seconds and multiply by 2, or 15 seconds and multiply by 4. Hold on, I need to let my kid through the gate. All right. Pulse can be taken in many areas. The wrist, the brachial, behind, posterior of the ankle, on top of the foot, behind the knee, on the carotid, the apical pulse, all over the place. And changes in heart rate could be due to physical activity, anxiety, hypotension, hormonal imbalances, coffee. It's a big one. Okay. Respiratory rate is assessment of the respirations. Okay, and males breathe through the diaphragm. Women tend to breathe through thoracic. Count when they're unaware, because patients can become self-conscious. So while you're taking the pulse, just leave your fingers on the pulse and then like get the pulse measurement. Actually, I like doing respirations first. So do the respirations first, and then once you get the respirations, do the pulse. So they'll think you're taking the pulse the whole time, but really you're counting the respirations. Again, fever, anxiety, exercise can increase it. You want to note rhythm, depth, and effort. It should be even, quiet, effortless, and when laying down and sitting as well. Blood pressure. Oh, good. We're almost done with this chapter. Okay, so blood pressure is the force of blood against the arterial walls. Cardiac output is the amount of blood ejected from the heart each minute, and peripheral resistance is the force that opposes blood flow through the vessels. Systolic pressure is the maximum amount of pressure on the arteries when the ventricles contract and eject blood from the heart. Diastolic represents the minimal amount of pressure exerted on the vessels. Systolic is always the top number, diastolic is the bottom. The difference between systolic and diastolic pressure is called pulse pressure, which is normally about 30 to 40 milligrams mercury of difference. Orthostatic hypertension is the drop of blood pressure when the patient comes from a lying to standing position. And this is common in older people. Blood pressure can be measured directly by inserting a small catheter into the artery that provides continuous pressure measurements of arterial waveforms, or it can be indirectly, either by auscultation, also known as a manual blood pressure measurement, or using a sphygmometer and stethoscope, or either by auscultation. Okay, so this one, auscultation, is when you can use like a Doppler to get the pressure, I believe. Huh. Weird. And then there's automated blood pressure, which is oscillometric blood pressure measurement. Huh. Indirect blood pressure is typically used in the upper arm. measuring the bare arm has been standard. Yeah. There's other sites such as thigh, ankle, forearm that you can use. Make sure that the cuff is fitting properly. That's huge, in that they're not crossing their arms. They're in a supine position. Their arm isn't elevated above or below the heart. Okay. So when you're taking a blood pressure, you're going to hear cord to cough sounds. This is the blood moving freely through the arteries of the cuff. So the big ones we want to hear is the first and last one, and then we take those. So when the first cord to cough sound goes, that is going to be your systolic blood pressure, and when the last cord to cough sound goes, that's going to be your diastolic blood pressure. If you're continuing on, automated blood pressure, it's important that it's accurate, and that the technology is accurate. And plus, a lot of them are very different, so just make sure it's calibrated correctly. Have familiarity with the equipment that you're going to be using to optimize results. Things that affect blood pressure is age. In adulthood, your blood pressure usually rises. Gender, females are normally lower. Pregnancy may gradually drop and then return after pregnancy. Race, so African Americans have higher blood pressure. Diurnal variations, so whether you're taking the blood pressure in the morning or night. Emotional, obviously, if the person's anxious, their blood pressure is going to go up. Pain, you'll get an increased blood pressure. Personal habits such as smoking, a cigarette will increase it, so you want to wait within 30 minutes. Or ingesting caffeine, so you want to wait 30 minutes before or after they are smoking a cigarette. Okay. Weight also. Weight. Obese people tend to have higher blood pressure. Common errors associated with blood pressure measurement are incorrect technique, lack of knowledge. If there's these can lead to false highs or false lows and inaccurate diagnosis. So really make sure you know what you're doing. Oxygen saturation is a routine vital sign measured by the pulse oximeter. And this guy, you just put over the finger and read it within 10 to 15 seconds. So not too early, not too late. Lower than 90 is considered abnormal. Normal is about usually 95. Assess the patient's pain and comfort level. That's the fifth, what they call the fifth vital sign. And you just want to listen to the patient mostly on how they're how they're feeling. Weight, genetics, intake of food, exercise, and fluid volume play a big role in your weight. Unintentional weight change in weight can be a significant finding of figuring out something if it's abnormal. Measure the weight using a balanced scale, of course. To check BMI, what you're going to do is you're going to do weight in kilograms divided by height in meters squared. Okay. There is 39 inches in a meter. So, yeah. Height is also influenced by genetic and dietary intake. Okay, that's common sense. And you just use the horizontal headpiece for that. All right, if you have like a weird pulse going on, you're going to want to have them lay back and do an apical pulse for a full minute. Yeah. Infection, renal disease, respiratory, cardiovascular disease, physical environment, emotional state, medication, food, fluid intake, and activity levels can influence all the vitals. When taking a blood pressure, make sure, of course, it's not too loose, not too low, that you're reinflating the cuff before completely deflating it. Waiting a minute or two before repeating a measurement. The patient's legs should not be crossed. Position the arm below, not below, but not above the heart too much. If you deflate the cuff too slowly, that's not good either. All right, moving on to chapter 5. Oh, I didn't even go over vital signs. Okay, so for vital signs, a systolic, the book says 110 to 139. But I would say a more accurate range is or a more healthy range is 90 to 119 for systolic. Diastolic is normally always 60 to 79. 60 to 100 is normal heart rate for an adult. 70 is the average for the heart rate normally. 12 to 20 is the average common respirations. Bo? Bo? Hold on 1 minute. Okay, I'm back. All right, so now we're doing a cultural assessment. Cultural assessments are influenced by unique beliefs and practices. Culturally and spiritually competent care is when you value the health, illness experience of patient through their eyes while helping them achieve optimal level of health. Hold on, Bo. Um, Changes in, hold on, and again. I'm back again. So yeah, you want to take in account of their culture. Changes to demographics reflect people coming to the United States, make it more diverse. There's also old country beliefs, so older people, they're I would say a little bit more uptight. Um, When helping a patient, you want to address the language barrier, if they have an alternative care provider, or if they prefer folk remedies. The definition of culture is religious affiliation, physical size, gender orientation, age, disability, political orientation, social economic status, occupation status, geographical location, and those are all culture. Um, uh, Ethnicity is the characteristics that a group share with common graphic origins, such as race, language, dialect, religious beliefs, shared traditions, symbols, literature, folklore, music, and food preferences. Race is eye, skin color, bone structure, and hair color. Spirituality is one's relationship with God, a spiritual being of higher being, reality greater than oneself, and essential, an existential, and not of the material world is spirituality. Okay. Importance of culturally and linguistically appropriate service. Office of Minorities or of the U.S. Health Department issued that all people need to have equal, equitable, and effective care. Culturally competent care, access to language services, and organize support for cultural competence. Using interpreters may be needed um, to communicate well. Um, yeah. Acknowledge, you want to ask first if they're comfortable, if they have any spiritual uh, beliefs that would inhibit them from you being performing on them, or if they ask them first if you touch them as well. Okay. CLAS requires that nurse develop cultural competence, avoid stereotyping, and develop a template. Cultural competence is essential to the required to provide culturally responsive care for all patients. Nurses must be motivated to have a cultural desire to become more competent to interact with people from different cultures. Nurses begin their cultural awareness through an in-depth self-examination of their own cultural background. Cultural knowledge is when the nurse learns about beliefs in religions and traditions and customs of other cultural groups. Cultural skill is demonstrated about the patient's health problems and perform a culturally based health assessment. Cultural encounters is what provides opportunities for nurses to interact with patients with a culturally diverse background. Um, Gotta open the gate for my kid again. Avoid stereotyping, regardless of the person's skin color, physical features, cultural heritage, um, social group, or spirituality. The nurse must show respect to that individual. Individuals with identify with one religion, not necessarily all have the same beliefs or practices. Learn that individuals are unique and deserving and respect and a personalized um, assessment of their beliefs and traditions. When assessing a patient, ask them about their health beliefs and practices to reflect on their cultural heritage. Improve their cultural awareness and sensitivity. Nurses should notice patients' behavior during an initial interview for clues about preferred communication practices. Um, Ask a lot of open-ended questions like what do you think the sickness is? Um, yeah, whom do you consult to when you're ill? What language do you speak at home? Do you have any spiritual needs or concerns for your health? Um, a whole bunch of questions. What's your diet like? Um, who makes decisions in your family? Also note what's around them. So notice religious books, rosary beads. Notice if a patient is wearing an amulet. Um, uh, for a spiritual assessment tool, what is your faith tradition? How is it? How important is your faith to you? What church or community? What is your church or community of faith? How do your religious and spiritual beliefs apply to your health? How can we address your spiritual needs? So yeah, moving on, chapter 7, last chapter of what we're doing. Okay. So this is mental health assessment. We're just looking at their state of well-being. The emotional part of the brain is the limbic system that triggers fear, anger, and sex drive. Neurotransmitters play a huge role, and we're reflecting too on one's abilities to cope with normal stresses, okay? Yeah. Uh, you'll normally get a data assessment done in the beginning that asks them a whole bunch of questions and compare those answers with the patient's appearance, behavior, and cognitive functions. The nurse will then interview the patient to collect subjective data about their present health and any past medical experiences. So this is where we figure out about past health history, family histories, psychosocial history, interpersonal relationships, stressors, anger, alcohol use. If they're suffering from depression, ask a very open-ended question for drug use. Like some people use recreational drugs. Have you ever used them? Stuff like that. Gender, age, genetics, and personal characteristics and psychosocial environment can affect if one has depression. Same with anxiety. Especially drug abuse can cause anxiety. Um, yeah, that wasn't under depression, but it is under anxiety. Yeah. Uh, so for depression, have you just felt worthless, lack of energy, crying spells? Do you not trust anyone? Have you felt this way before? Have you thought about hurting yourself? Anxiety would be difficulty concentrating, nausea, fast heartbeat. Um, you notice frequent changes in your thinking and feelings. Um, Altered mental status. Mental status is defined as the degree of competence that a person shows intellectual, emotional, physiological, and personality functioning. So for memory, you're due in orientation actually first. First, you're going to do orientation and introduce yourself. Let them introduce themselves. Now move on to memory. Have them repeat a word. Um, have give them a word and say, "I'll ask you about it a little bit later." Um, do remote memory. So something in the past, like what's your mom's maiden name? Calculation ability can be tested by a patient doing a math problem. Because Communication skills, have them repeat, ask name, read, write, copying. Okay. Judgment and reasoning. What would you do if a car was speeding towards you? Abstract reasoning. If you have a bird in the hand, a bird in the hand is worth two in the bush. What does that mean? Alcohol use. People who are alcoholics usually deny or minimize their drinking. It's more a matter of fact, and yeah. For men, fewer than 5 daily or 15 weekly is normal. Fewer than 4 daily or 8 weekly is normal for women. 65 and older, no more than 1 standard drink daily or 7 weekly. For pregnant women, no alcohol consumption is safe. So, ask them, so look at their patterns. Are they risking bodily harm? Having trouble with friends and family, role failure, run-ins with the law, because this is a mood impairment. So you're you're going to want to look at their actions associated with. If they're abusing alcohol, look at alcohol dependence. Use a tool called an audit test. So alcohol use disorder identified test. And this asks 10 questions. And another tool you can use is CAGE, which is cut down, annoyed, guilt, and eye opener. Drug use. They'll also deny so they don't get judged, and it's more matter of fact. Ask them, have you used drugs in the past? Because some people do that. What type of substances? And then is it so like prescription methamphetamines, inhalants, hallucinogens, prescription opioids? How long ago? Do you have a desire or urge? What has led to health or social problems dealing with this? Have you failed to do normal things expected of you? Have you ever used any drug injection for non-medical use? Interpersonal violence is not an illness, it's a crime. Be calm, matter of fact, and non-judgmental. Are you asked about violence because people are dealing with you are asked about violence because so many people are dealing with this problem in their home. Nobody deserves to be afraid in their home. Abuse is a problem. May you talk with me about your home safety? Do you feel afraid of your partner? Have you ever destroyed things that you valued? Has anyone threatened you? That sort of thing. Mental illness, suicide prevention. There's a whole bunch of screenings, USP, STF. So U.S. Preventative Service Task Force wants to screen now of drinking and violence and abuse and follow up if there is abuse. So when looking at mental health, perform hand hygienes, observe the patient's gait and posture, their facial, tone of voice, rate of speech, respirations, blood pressure, pulse rate, pupil size. These can tremors, anxiety, anxiety. Alcohol can change the white of the eyes, pain, outlandish makeup, maybe someone with bipolar. Okay. Uh, okay. Moving on. Major depression is when someone has hopelessness, sadness, helplessness, worthless, and despair from some personal loss or tragedy. It may interfere with the ability to work, study, sleep, and enjoy pleasurable activities. A person must have been depressed for more than 2 weeks for it to be considered major. They must have persistent sadness, anxiety, empty feeling, guilt, helplessness, reduced appetite, insomnia, fatigue, suicidal thoughts, difficulty concentrating and making decisions. Bipolar depre- oh so for detect rapid eye tests for drug intoxication, nystagmus, jerky eye movements, convergence, if they inability to hold the eyes cross-eyed, corneal reflex, decreased rate of blinking, pupil size is dilated, the pupil reaction is slow and sluggish. Look at redness of sclera, ptosis, retracted upper lid. So those can all deal with drug intoxication. Moving on, bipolar disorder, they'll have mixed moods and have episodes of mania and depression. They'll have excitement, hyperactivity, boisterousness, inability to concentrate, decreased sleep, delusions of grandeur, limitless injury, and then suddenly become into a depressive phase of sadness, loneliness, guilt, lowered self-esteem. Schizophrenia is impaired reality. They have hallucinations and delusions. They're flat, blunted, inappropriate, bizarre emotions, illogical speech, impaired thinking. Um, It has been noted with autism um, and delusions and hallucinations are actually autistic thinking patterns. Anxiety, feeling uneasy, discomfort, can be mild to panic, fearful when no actual danger is present. It can be mild, moderate, severe. Mild is when anxiety heightens sensory stimuli. Moderate is when there's narrower perception, of perception, inattention to ignore stimuli, um, focused on a specific concern. Severe anxiety is reduced perception, develops compulsive mechanisms to avoid the anxiety provoking object or situation. Intense terror and unable to think logically or make decisions is associated with this. Obsessive compulsive disorder, I had this. um, so OCD is an anxiety disorder, repeated obsessions and compulsions. Obsessions are unwanted, intrusive, repetitive thoughts. Compulsions are repetitive, ritualistic behaviors to help reduce the anxiety. Most common is um, needing to have particular order, contamination, doubts, and obsessions with sexual imagery. Post-traumatic stress disorder, acute stress disorder, extreme trauma such as combat, rape, physical assault, near-death experiences, witnessing a murder. PSD will have symptoms of ASD for more than a month. And it'll just be generalized anxiety, intrusive thoughts, flashbacks, nightmares, and other sleep disturbances. Substance disorder, repeat use of drugs for pleasure, or to increase performance, stay awake, or lose weight. Alcohol abuse is a central nervous system depressant. Um, Alcohol intoxications can cause maladaptive behavior, fighting judgment, mood changes, irritability. Alcohol withdrawal will have signs of delirium, tremens, withdrawal delirium. Um, Within 6 to 24 hours of their last drink, and it will peak 24 to 36 hours and end after 48 hours of abstinence. You get normally vomiting, diaphoresis, increased blood, heart rate, blood pressure, anxiety, irritability, and insomnia, tremors, agitation, fluctuating disorientation, confusion, hallucinations. Drug abuse is what are called stimulants, produce anxiety, depression, mood swings, irritability, sleep problems. Intoxication can cause euphoria, slowed thinking, reaction time, confusion, lack of coordination. Drug withdrawal produces manifestations based on the amount of drug use, and they can consist of vomiting, muscle pain, disturbed sleep, depression, anxiety. Delirium is the disturbance of consciousness and change in cognition that develops over a short period of time. Um, you'll see delirium in sundowning. It's a it's the mixed type when patient symptoms fluctuate between hyperactive and hypoactive. Dementia is memory impairment. And there's so many things that can cause this. Apraxia, um, inability, impaired ability of motor activities, agnosia, failure to recognize, um, all that good stuff. And we are done with chapter 7.